Ingawa sometimes napatana na umati kama Juda na kuuza bei 30 wewe wakati umenishika hauniachi kwanza unanidunga makaimati rafiki wa dhati. Ingawa sometimes napatana na umati kama Juda na kuuza bei 30 wewe wakati umenishika hauniachi kwanza unanidunga makaimati. Hajawahi niangusha, hajawahi niangusha, hajawahi niangusha, hajawahi niangusha.
Hello everyone, good morning. Welcome everyone to sit down and settle in so we can begin.
Nitoe kabisa. Discord. Ikuwe rahisi.
Unasikia aje?
Nyonge tu. Buda sifanye kazi yako.
Jina lake juu Kilimanjaro, kutoka nizaliwe Ungwaro, nikicheza na Ungwaro, akanitoa chini kwa mtaro, jina lake juu Kilimanjaro.
Hello. Sasa muone ngekata. Unaisikia? Antu. Mic test. Luve.
Unajua mzee amekaa hapo kama 30 minutes. Huko ndio ningemvalishia. Sasa mimi watu walisema watu wabaya. Mimi nimesikia sasa nilala mzima ndio wewe unasikiza nilikuwa nasikiza hiki. Ndio ni kwa
Kobeta. Kofiti, Ruby. How are you? I'm awesome. The sound engineer. I want to put the mic on you.
Oh, okay.
Yeah. So where should I put it?
Oh, okay. Yeah, okay.
You have a pocket inside.
I don't have a pocket, but this will do, I guess.
Oops.
Trouser.
Oh, yeah, okay. Yeah. Nitanyamaza.
Utanyamaza. Sawa.
You are here, working in this place. I worship you. I worship you. You are here, moving in our midst. I worship you. I worship you. You are here, working in this place. I worship you.
Hey, man. Great to see you.
Yeah,
You lost a lot of years.
I know, but we're just trying to, keep it going.
Yeah. Great.
And well, yeah, get a chance to chat. Just want to say, great to see you.
Thanks. We got more to talk about. With my daughter, Marilyn, Doug Blackie. He's an escapee from the NBA.
Yeah, exactly. Yeah.
Touching every heart.
Yeah.
I worship you. I worship you.
Good morning once again.
You are here, healing
We'd like to
every
start
heart.
the event. We are very happy and humbled to have all of you with us here today.
I
As
worship
you know, we are here to celebrate
you.
Dr. Shaffer and all of us who are
Turning
doing
lives around.
in not only establishing the community health movement, but mentoring the next generation of health workers who are transforming the healthcare industry in Kenya. So we are very grateful, and not only in Kenya, globally. So we are very grateful, and we are here to reminisce. Nikki kept saying it's a meeting of old friends. So feel free, and we hope you'll enjoy the day. So as we begin, I would like to formally invite you to Amref International University. We are glad you could be with us. My name is Dr. Lydia Tambo, Head of Department of Community Health. So you are our guests, and we are elated that you could be with us today. I will call Dr. Meshach to do the formal welcome as we start off the program. Karibu Daktari.
Yes, good morning. Today is a very special moment for myself and for many of us who work for this organization, and also for those who have benefited from this organization and those who are associated with this organization in any way. I remember with fond memories about 20 years ago when I was the District Medical Officer of Health in Northern Kenya. And at one point, I was thinking about my career. And at that point, I was wondering, should I join the World Health Organization, World Vision, or the WFF? And what made me choose Amref is a story, is how I felt. I was working for government those days. But whenever we had an emergency, we needed evacuation. We'd call flying doctors, and within an hour or two, flying doctors would be there. We had women who had hydatid cyst and another chronic conditions. Women who we knew if nothing was done for them, they would certainly die within 2 or 3 years. But Amref would send surgeons there, and within a few days, a few weeks, they would walk home healed. That's the reason I joined Amref. Now every story has a beginning, and today is the story of that beginning. So I truly want to welcome all of you to Amref today, to commemorate the story of the beginning of Amref, how Amref was born 50, 60 years ago, and to celebrate it with the ones who created that story. So it's an honor, truly an honored to have people who worked with our founders. None of our founders, initial three founders, is alive today, but people who worked with them day in, day out. So very honored to have John Ramba, Joyce Naisho, Douglas Lucky, Professor Miriam Weredon, the Shukam, and Roy Shaffer, who we are celebrating today. Mine is to welcome you to be part of this commemoration, to celebrate and to really reflect and think about where and how we began. It is now 60 years later, 62 years later. We are now probably on the second and the third generation from the founders, those who worked with the founders. We are at that point when we are also asking, what type of organization shall we hand over to those who are coming after us? You are our inspiration. Once again, welcome, and we really look forward to an exciting time. Thank you.
Thank you, Daktari, for that very warm invite. And we celebrate all of you. We shall keep celebrating you the whole day. So we welcome you. We want to invite our guests of honor. I know Dr. Roy will speak when his time comes, but I want to invite Marilyn to just invite the fact to tell us who have come with Roy, who you are and who Steve is, just for 2-3 minutes. Let us know who brought Roy to us.
Good morning. Thank you for the privilege of having us here today. As many of you may know, my mother passed away this past June, and she was unable to travel before she passed away. So now that she's in a better place, Steve and I, my husband Steve, we're from Arusha. We were in America, and we invited Dad to come back with us. And he jumped at the opportunity. So that is how we have Dad on this side of the world. We are taking him on this safari. It's an honor to be able to do that, to reacquaint him with his friends and family members. We are bargaining with him. We would like him to stay in Africa where he belongs. But of course, he has children on the other side of the ocean, so let's see who wins. But my niece, Dad's granddaughter, Emily, flew in from Cape Town. She's with the US consulate, and my husband grew up in Tanzania, and Dad born and raised here, as you know, and I have the privilege of being his daughter. So thank you for having us.
Thank you, Marilyn. Sorry for the ambush. Yeah, so we welcome you and we are happy to have you. So we'll have a welcome speech from our Vice Chancellor, Professor, who is with us and has graced our occasion. So we welcome you. Please come and welcome all the guests to AMREF and start us off. Thank you very much.
Good morning, everyone. Thank you for creating time on a Saturday to be here. I think that really shows commitment that we have to the cause of what we are doing. We are really grateful. And when I heard about Roy and the history and the radio program and the starting of the community health program in AMREF, I felt challenged. You know, we all work for AMREF, and we keep saying we want to leave a mark, we want to be remembered for something we achieved. And when I heard about Roy's endeavors in those early days, and the difficulties that you had to go through to bring what we do now, because AMREF is basically known for being a community and brave organization. And that has sold us all over the world as the African organization that understands communities in Africa. And so when I saw the story and the history and everything that you've done, I felt challenged. And I said, what will we be remembered for? We who work for Anthem. Will there be a time people say, Professor Stu was here, this is what he did. Can they stand on my shoulders like we stand on your shoulders now to even do better things? Can the legacy that we create lead to something big that we are now seeing today? And so for me, one is to thank you. And then again, traveling during this time of COVID and other inconveniences and bringing members of your family to raise this occasion, I think the commitment has not died even with your age. You lived for it, you worked for it, and you're still in it in your heart. And we appreciate that. And it's a challenge to us. The promise I can make for all of us who are here, because I know our staff, we are committed to carry on with that vision. And we will do it from where you went. I know other colleagues have come along the way, like I saw Professor Miriam Were. These are our mentors, and they are carrying on that vision, and we are working hard with them to move on from where you went. The big thing that we are looking at is, can that poor person in the community, that neglected person in an isolated part of Africa, hear about health, own their health, and get health services? That is the vision that we continue to carry. And I think you started it off, and you can trust that we continue with it. So thank you very much. Thank you everyone for coming over. I had another meeting which is going on, so I may pop out at a certain point. But our team is here, a great team. Our students are also here. We see our students as the bridge to the future. We have had a great past for almost 63 years now, and there is a big future ahead of us. We are right here managing, but who then carries what we do to the next level? It is these students. And we keep telling them that the classwork is fine, they need to get the skills, but it is the mentorship, the things we do outside of class, the vision that you develop over time as you interact with other projects, that is what will really make the difference. Otherwise, anybody going to any university can get that knowledge, but it is the difference that comes with interacting with people like Roy, with people like Professor Miriam Mere. That is what makes the difference, because we want to step into your shoes. So for our students, it's a great opportunity, and I hope that you pick something and you also create connection to carry this vision forward, because the future is in your hands, and ours is to make sure that you get the right vision to move it forward. So thank you, everyone, and looking forward to a great day. Thank you.
Thank you, Dr. And that's quite a challenge. That Roy has done his work and he has done it exceptionally well. The question to all of us is, what mark shall we leave? To all the students and to all the staff members and to the AMREF family, what will we do to transform our community? So at this time, I invite the faculty members who are with us. Of course, Professor Suri is here with us, with the Vice Chancellor. We also have Dr. Lakati with us. Maybe she can wave before. Yeah, she's our graduate school head, as well as the head of the research department. So we thank you for being with us. We also have our students with us. Maybe you can wave. Yeah, they've been quite supportive, and they're also on their way. They will come and join us. So as we continue with the program, I would like to invite Dr. Lakati to come and give us a background of the Department of Community Health, where we started from, where we are looking to go to. And we keep welcoming you. We welcome you to our event, and we are happy that you're here with us. Karibu, Dr.
Thank you so much, Lydia. I want to start by really appreciating Dr. Shaffer. The reason why we are the work you started with many others. I also want to acknowledge the Vice Chancellor, Professor Sur, who is leading us in the university, and I know that we are heading in the right direction. I want to acknowledge all the senior people who are here, people who taught us, Professor Miriam Were, Joyce Naisho, all the team that is here. I want really to acknowledge all of you. I want also to recognize Dr. Ramba, because when we started the university, we said that our laboratory is the country office, and we have continued to do that. So I'm going to take us through the presentation about the department, and probably I might miss something because there are people who are here who studied the department. So I'll take us through the journey of the Department of Community Health. We are really proud to be the founding department of the training center and the founding department of the university. Next slide. When I was going to the archives to look for history of the staff of the department, I came across this picture that was going to in the 1960s. Chris Wood, visited the Department of Community Health. That is long before many of us. So that actually tells me that there's a lot of work even done before then. And the work of community health goes into, of course, there's a lot of years. And the work of community health goes into, I want to acknowledge the trailblazers looking at the history when I was reading through Dr. Roche, and after that, I think their thinking was right, because they recognized that as medical doctors, and then after that, health does not start at the hospital. Health starts at home. When people come to the hospital, it's because they have lost their health. And that is why the need for the importance of community health was born. So, in 1987, that is when the first program and the department was formed. That is a program that was called Diploma in Community Health. And then it was accredited to McMaster University. And many people who are here are aware that they taught this course for many years. From 1987, that is actually more than 30 years, if I'm not wrong, or around almost 30 years now. I also came across this, that the need to train in community health became more and more important. And therefore, this building that has become our university, there was a funds drive to really grow this building through a bio-bridge initiative. And you can see that then President Boy, then the chair, there was Dr. Kiplagat, they actually own this training center. I don't know whether anyone thought this training center that was open to train the diploma program was going to be a university someday. Next slide. They actually so the training program that is the Department of Community Health, this training center that was a hands-on training. And these pictures were in the university training activity. Next slide. Students used to go to the field. So the training program that is the department, the founder and the people who are here was a hands-on training. They used this picture. You can see that the luggage was handled here. So they were students when found that was they were used as what and they were able to understand what made changes in health. But the small interventions they were used as what and by the time the university was starting, the department already had so you can see Dr. Shaffer that the work you started has spread out by the time and how people who are benefiting from department throughout all these parts of Africa. That actually you can see a very, very big work you started has spread out by the time. In 2023, you all know that education became a bit requires accreditation in Kenya, and therefore AMREF sought partnership with Moi University. So the department led the accreditation of the program Moi University, and you can see there a name was signed in 2023 for the program to be accredited to the university. So in 2005, AMREF started graduating students in the diploma Moi University. In 2007, the program, the department was still training students, and the students that were coming were funded, but funding started going down. And that is why the department went through the challenge of converting the course into an online. And the students, so I was not working on funding, but I was working on the mind, and I was involved in writing. When we were writing this course and converting the department online, so we were fearful that when we go online, maybe we shall lose our lives. But the department took the challenge and then converted the program into an online course. Moi University reviewed the curriculum and they say this curriculum is too detailed to be offering a diploma. And that is why they revised the curriculum to be a higher budget, because they looked at what the content, the experience that the department is giving is actually higher than a master's degree, and that is why, and that's where the course was revised to higher diploma offered online. What the content, the experience that AMREF went through a journey, and they in 1st of August 2017, AMREF got a letter of mutual authority to the university. For you to be a university, you must submit a curriculum to a university. As a department, the department pioneered the development of a curriculum that actually gave AMREF university status. For you to be so we developed a curriculum with a title Bachelor of Science in Community Health Practice. The team started community health. Why did we add the word practice? It was not just operation. Because when we looked at the history, we realized that it is actually the practice that makes a difference. And that is why today the department is training graduates of community health practice, because we want to emphasize the importance of practice as what is going to make an impact in the achieving the department. So the department continued to lead Dr. Shaffer, and therefore this year the university graduated the first graduates. So the first graduates were from the department, and interestingly, and therefore this is not It was not by plan, but these are the group that were resilient to complete the course on time. And maybe they were just demonstrating that really helps the household, and we all know that it was not by plan, but we really like to see more and more men, and very many. Maybe they were just that joining that. So, Dr. Shaffer, I want to say that the work you started has gone beyond where it was, and today we have this team that has joined the workforce. Some of them are actually interns at Kenya, and we are very, very happy that as an academy, we have continued to lead the way it was. And today, where is the department today? From a department for interns and one for what I want to say, the seed that you planted, you and the team that is here has grown. It has grown a very big tree to branches. Since I come from the silent, one acacia tree is very important. What I want to say is that is actually about life. So the department has not only expanded to having a in 5 countries. Now we have 4 programs with more than 2 students. We have a Master of Public Health. So our Master of Public Health is not just any master. It has 3 tracks. One of them is school health and safety. Why? Because we want to contribute to the school health and safety. And it has a track of public nutrition, because we know there is importance of nutrition in the long life of only one of us. It has a track of applied epidemiology because of the importance of research in part of policy. And of course, we have our pioneer course, Bachelor of Science in Community Practice, the higher diploma and the diploma. So the department has because of the next slide. So we keep moving forward. Of course, we have our pioneer in the pipeline. We intend to start a master of sexual and health rights and policy. We also intend to start a master of science in water sanitation. So the work continues. We imparted practice of community health. Health rights and policy. We want to say our tree continues to be water sanitation, and we continue to make a difference in the university and the communities that we serve. Thank you for starting us off, and we really, really appreciate. We want to say, and as this is saying, those of us we are here, we need to ask ourselves, what shall we remember? So we take this challenge that we continue to grow, and we really thank you. Those of us who are here.
Thank you very much, Dr. Lakati, for taking us through that.
So we take this challenge
and we endeavor to keep growing. Thank you for that call. And we tell our students that together we can move forward. You're the next generation, and we are here to support you. So at this time, we will take a break. But as we said, this is a celebration of friendship, of people who work together to do healthcare in Kenya. So outside, we have self-care, where we can all take photos and celebrate. We are looking at photos of days past. And so some of the photos we will take today will also be seen in later years. So let's take a few photos. We have our hashtag for today. It's hashtag and so we can also post some of these things on there to celebrate Dr. Roy Shaffer in the work of the community health workers and the impact in society. So we welcome all of us to go outside and take photos, and then we go and take our impressions. We can also post some of it. Thank you. Celebrate Dr. Roy Shaffer in the work of community health workers and the impact on mental health.
Yeah. Yeah.
I don't think I remember you, but my name is John Ramba.
Ramba. Oh, yeah. Yeah.
Yes, there we go. There we go. How are you doing?
Yeah, good. I feel very good.
You're looking good.
A bit oozé, but
well, they say oozé is not sickness, so don't worry about that.
okay. Yeah, John. See, you're the other John.
I'm the other
John Siranga.
John Siranga. You know that. You do remember all the good old days. That's right.
Yeah, well, he was a fellow Maasai.
I know, but I used to run the information, was information and communications.
Oh, yeah.
The other smaller room, building over there.
Oh, yeah.
It's so nice when
Great.
people told me about
Thank you.
this. I got so
Welcome back, everyone. I hope you enjoyed your break. So at this time, we will invite the students to give us a number. We call it a number, a song. Yeah. Karibu sana. I'm sure we can appreciate them much louder than that, yeah? We are very happy to have them join us and to be actively participating, so we thank you. So at this point, I want to call the chair of the Students' Council at the university to give us a short speech, and then we shall move forward. Karibu Anjogu.
Thank you very much, Dr. Tambo, and to Mr. Roy, our guest of honor. We are really glad to have you here this morning. Dr. Dirango, thank you for gracing our occasion, and members of the AMREF Council, and all our guests. It is really a pleasure to have you here. We call AMREF University our home because a lot of us as students spend more time here than we actually spend in our own houses. So this is home for us. I'm going to be very careful as I talk. Some of my teachers are here. Some of people I regard very highly are here. I can see Mr. Giorgio Ello behind there. He'll be listening and saying, "Anne, I'll meet you later in class." So I have to be very careful as I speak. But it is really an honor. What is happening here in my thinking, and the VC alluded to it, is a transference of a vision. And how do you know the success of a father? You know the success of a father, not in the children that he raised, but in his children's children. And I think Dr. Dirango said that we are, I think, in the third generation of AMREF and the CHP vision being carried forward. So when, as a father, you're able to translate values, and those children are able to pass those values to their children, then you say you have been successful. And I would like to say that, Dr. Roy, you have been successful. When we look back to the history, we've seen 62 years. I was not even born. I was probably not even an idea. And we have people who are even younger than me taking on the baton of community health service. As a country, we have made progress. People who are even younger than me taking on the baton of community health service. As a country, we have made progress. People who are even younger than me taking on the baton of community health service. As a country, we have made progress. People who are even younger than me taking on the baton of community health service. As a country, we have made progress. People who are even younger than me taking on the baton of community health service. As a country, we have made progress. People who are even younger than me taking on the baton of community health service. As a country, we have made progress. People who are even younger than me taking on the baton of community health service. As a country, we have made progress. People who are even younger than me taking on the baton of community health service. As a country, we have made progress. People who are even younger than me taking on the baton of community health service. As a country, we have made progress. People who are even younger than me taking on the baton of community health service. As a country, we have made progress. People who are even younger than me taking on the baton of community health service. As a country, we have made progress. People who are even younger than me taking on the baton of community health service. As a country, we have made progress. People who are even younger than me taking on the baton of community health service. As a country, we have made progress. People who are even younger than me taking on the baton of community health service. As a country, we have made progress. People who are even younger than me taking on the
Next generation speak such words of affirmation. So we are happy. Dr. Roy, well done. Next, we'll have Samson Tatio, who is a student from the Community Health Department, to also give us a short speech. We'll have Samson Tatio, who is a student from the Community Health Department, to also give us a short speech. We'll have Samson Tatio, who is a student from the Community Health Department.
Our chief guest at Anthem International University. joined AMREF International University, the place that I have called home for a couple of 4 years ago. Very first day that I set my foot at this gate, I never could have imagined that probably one day I could address such great team of people. Very first day that I set my foot it's such an honor, honestly, to be here. I never could have imagined Dr. Shaffer, before I actually appreciate you, because this is actually your day that you have set as a pillar that we are actually seeing and appreciating today. I would like to actually say what really motivated me to take a community health practice. I am a clinical officer by profession, having trained at Kenya Medical Training College, and I work with Kajiado County government. And over the past few years as clinical officer, I have had extraordinary privileges of traveling all over and across the county where I worked in. And the people that I've met and the stories that I've had in the community, I have always seen the very best of the people from the community, but the lack of awareness. And let me begin by giving you stories just very quickly of my two patients that really motivated me. One, imagine, let me call my first patient, patient X, for privacy and confidentiality of our patient. Imagine someone who is suffering from 4 chronic illnesses, a cancerous tumor, tuberculosis, HIV and AIDS, and a spinal injury, all clamoring to debilitate you. And yet, even at the highest dose of pain medication available at our avenues or disposal, this patient is still in constant pain. And yet, the only hope for this patient is yet to see his yet to be born child. He managed to hang on valiantly. And I remember we were holding several meetings with consultants and other colleagues, wondering and questioning the wisdom of admission of this patient at our facility. And we were wondering, what can we do best for this patient? I remember actually thinking that probably this patient can be managed better in a well-referral hospital rather than where we work. Sadly, he passed on 3 months later, and this reminds me of a quote from Khalil Gibral that says, "Out of suffering has emerged the massive character that has seared with scars." My second patient, let me call her Madam Y. She's a single mother of 3, the eldest being a 12-year-old. She was admitted at our facility, and during her long stay at our hospital, which was 1 month, we were all worried about her health. And every time I saw her 12-year-old boy bring uji, which is porridge, to her at the hospital, my heart broke, because he was still the one taking care of the 2 little ones at home. And I remember praying to God to heal Madam Y, because she could be able to save the situation back at home. And this story of my patients is one that is replicated in several other areas, not only in my country in Kenya, but in the entire sub-Saharan Africa. Korean International Cooperative Agency came in, and we started doing what we call medical campaigns and medical camps. So when we went for community diagnosis, I met many more who were as sick as my 2 patients. And I realized actually my 2 patients were so much privileged to be at the facility, because they will access medical services wherever they wanted at any given time. I met many more who will not use the facility because social cultural factors, probably those who will choose to have deliveries by traditional birth attendants rather than skilled labor. We'll have those one, probably poor road networks and lack of public transportation hinders them from accessing medical facility. And this is when it dawned on me that when we go directly to the community, we can do more as individuals, as non-governmental organizations, and as the government themselves. And this is why when one day Dr. Lakati came to our facility, and I was seated behind at the seat, and I was listening to how they were talking and the importance of community health. And it dawned on me that I can do more when I take community health. I found myself here 4 years down the line, and probably when soon I'm graduating, I'll join a master's program. So that means this was a great foundation. Dr. Roy Shaffer, we really appreciate this great effort that you have done, and the other pioneers of community health that were determined that AMREF will no longer remain the same. And not only just AMREF, because I've seen you have worked in AMREF and any other places, a lot of places in East Africa, Tanzania and Uganda and Kenya. And this has impacted. It was like a tree that has been planted. And when we always say that when we want to know how strong it will be, it has to deal from the foundation. When we see a tree that is shining outside, then the foundation was great. And I'm here telling you that we are upholding this, and we really appreciate the history that has been read for us. It's great, and I really appreciate you. Thank you so much.
Surely the next generation is ready. What do you think? Yeah, do you all agree with me? So our next speaker is George Oele. George Oele is a qualified community health practitioner who has also mastered in the same subject. He's qualified in global health MBA and is a qualified public health officer. He's worked with the Ministry of Health for many years and later joined AMREF in the year 2008 and has been with us to date. He's a technical advisor for the AMREF on the community health workers and the community health services. I would like to invite him to come and give us a word. He's representing Dr. Meshak, he's representing Martin Mushangi from the WASH department, who were gracious enough to support and financially give us a financial donation to support us on this day. So we are very grateful that he can be here with us. So karibu sana, George.
Thank you, Dr. Tambo. To Dr. Roy Shaffer, our chief guest, that we celebrate this day, the leadership of AMREF International University, Country Director, AMREF Dr. Ndirangu, our mom, Professor Miriam Were, who has once led the leadership and governance of this university or this institution, AMREF, and all protocols observed. My name has been introduced, George Oele. Currently, I work for AMREF Health Africa in Kenya. I take this great honor and opportunity to represent my colleague, Martin, who was supposed to have been here, but he traveled. But we share the same vision. We share the same dream of working and providing for our communities. As it has been said, I wanted to narrow my emphasis on the contribution and the foundation that was laid by Dr. Roy and other visionaries in the early days. The foundation they laid. We are, I think, not even a third generation. We must be a sixth generation today that are building on that foundation. AMREF was founded on the premise of community health in Kajiado, in Kenya, in Narok, and parts of Tanzania. And during that time, he who is here, the young boy you see here today, we are celebrating, he was using all his might in knowledge, the skill, the desire, the dream to save a life. By then we had King George Hospital, which is currently the Kenyatta National Hospital, where they could fly those they could not manage in the community. But the program that touched and moved the lives of the people was identifying means and ways of disease prevention, identify mechanisms of health promotion, and working together with communities through community-based programming partnerships to discover how to manage elements that they could manage as a community to bring life to the household level. And in that context, they worked through various programs that were integrated. They look at the hygiene component of the person and the environment. And they look at what composes, define the environment and hygiene. And they saw sanitation as critical. And they identified that safe water is important. Then they realized that people need education. And they started community-based training where they could provide health education on behavior change, on the use of safe water, on the use of latrines, that we could avoid disposal of fecal matter in the environment that lead to contamination of our water bodies. Our chief guest of honor, I want to tell you today that that foundation you laid, together with Chris Hood and the other important dignitaries then, lives on today. As AMREF, we have impacted the lives of Kenyans, the lives of people in East and Central Africa, Tanzania, Malawi, Uganda, Ethiopia, South Sudan, included in health promotion. We have seen that there are diseases going down because of safe water usage. AMREF has contributed in drilling of boreholes in communities so that our communities could access safe water. AMREF have contributed in health education towards behavior change. As they provide that safe water, they educate them on how to maintain that water to be safer from the point of collection to the point of use. Because a borehole in the community sometimes is sunk maybe 5 kilometers away, depending on the environment. That must be carried home. And the concept of hygiene, observing cleanliness of the vessels of use and our personal hygiene is important. Our communities today, they know that. As we talk today, community health workers has been recognized because of the effort of AMREF. 2006, AMREF contributed vehemently in transforming health agenda in the African region through the discovery of the gap that was existing between the communities and the formal health system that was not documented. We were working in communities, but the formalization of that work between the community and the government was assumed. AMREF contributed, and today we talk of community health strategy in this country, in Uganda, in Malawi, in Tanzania, through the contribution and the efforts of the skills and competencies of the AMREF community. That you left a legacy behind, and through that training program, we have benefited from. We have gathered skills, we have gathered knowledge, we have gathered competencies that have changed the environment. Trachoma program in the hard-to-reach areas is a big program that you started, and it is moving on. Many people today, their eyesight are managed because of your dream. Time may not be there for me to emphasize your contribution that has changed and turned around the lives of the people in the community. Thank you very much for that effort. We will continue your legacy beyond this day. Thank you.
Thank you, George, for that experiential speech. Having been in that community health movement, you really understand and have experienced the contribution of not only Dr. Roy Shaffer, but of all the community health workers that have been within the AMREF family. At this time, it's my pleasure to introduce the AMREF Health Africa Kenya Country Director, Dr. Meshach Ndirangu, to give us a short speech. He is a medical doctor by profession, then later moved on and did his MPH, and later on an MBA. And he's a specialist in strategic management and is one of the pillars of the AMREF team. So we welcome you. Karibu sana, Dr.
Thank you very much, Lydia, and good morning once again. Dr. Roy Shaffer and your family, thanks for honoring us with the gift of your time. We very much appreciate. And for all of you for believing in the spirit and the philosophy of community health, we very much appreciate you. I think the speakers who have spoken here have talked about the foundations that Roy and your colleagues, you helped establish, which form the basis of AMREF today, which define the DNA of our organization today. And for that, we truly thank you. And recognizing that when AMREF was founded, there's this saying that you're using the tools. AMREF is about using the tools of our time. That time, it was the plane. Because patients could not come to hospital, you go to where they are. And it was also the radio. I remember AMREF radio when I was at the university. And glad to meet the one behind AMREF radio. And thank you very much for that. We had the plane, we had the radio. Those were the tools of the time. And I think what we are being challenged today is to keep asking, how do we build on these foundations that Roy and colleagues who are here helped found using the tools of their time? So that we are preparing this organization, we are preparing the continent for the future. And we have a solemn duty to do that. And therefore, let us take this opportunity to reflect and ask what we learn. And a few challenges I'd like to share with you. They are only illustrative challenges. Number one, today, how well are we connecting the spirit of community health with technology, the mobile phone, and the new emerging technologies that we need to create connections with? Roy, you used the radio. Today we are using FM radio. Today, I remember when COVID started, AMREF Health Innovations was able to train more than 50,000 community health workers to slow down COVID by talking to household members about prevention. And they were trained using the mobile phone. So the one challenge for us is to keep connecting community health to the tools of our time. We're doing it, can we do it more? The second one is to keep connecting community health to the threats that face us today. In our organization, there has always been a debate of whether we are an emergency organization or not. When COVID started in March, or rather got to Kenya in March of 2020, there was no debate. We all knew this is the battle of our lifetime, and we have fought the best way we can to slow down the pandemic. In Asia, with behavior change, sanitation, hand washing stations, and now supporting vaccine rollout. And the organization has been in the forefront, even on the issue of vaccine equity, with excellent leadership from our group CEO, Dr. Githinji Gitahi. Now,
connecting community health, recognizing the role of community health, and the way community health is connected with our own survival and our ability to thrive as a human species is so important. Community health workers have been able to walk into households, tell households have been vaccinated. They are trusted agents of society. And when they do that, we're able to slow down global health threats such as pandemics. So connecting community health and the philosophy of community health to be at the center of global health security, because that's a big issue today. That big challenge to us is beginning to connect community health to one of the other biggest challenges we face in Africa, financing. We know that there's so much we want to do, but sometimes we are limited by the amount of resources available. And what are those connections between community health and financing? There are so many, but for illustrative purposes, there are a few examples. One is in Kenya, we have seen counties develop new laws, put laws in place that allow for resource allocation for community health workers. Parliament in Kenya today is debating a new law. We hope it will be passed in a few months' time to guarantee the financing of community health workers. Community health workers walk into households and they convince households to buy social health insurance for their own financial protection. Now that is financing. That's financing of healthcare. Beginning to see the service delivery roles of community health, to the role of community health in helping leapfrog and advance the financing of healthcare, because health insurance is one sure way of making that happen. And as you know, financing is one of the big barriers towards the realization of UHC. The fourth one is evolving with the times. We still grapple with communicable diseases, TB, HIV, malaria, cholera, now COVID-19. But there's a new kid in the block, not so new. Today, if you walk to the Kibera informal settlements here in Nairobi, the informal settlements, and take 100 adults and check their blood pressure at random, 20 of them will have elevated blood pressure. A good number will have elevated blood sugar, you'll have diabetes, and so on and so on. Beginning to recognize that there is something called epidemiologic transition. And we are now grappling with the double, if not triple burden of disease. And beginning to ask, what is the role of community health in helping us confront the double burden of disease? And more so, non-communicable diseases, diabetes, hypertension. And we know the remedy is in lifestyle modification. Lifestyle modification is the most difficult intervention in public health. Just COVID vaccination alone is not easy. People say no, vaccine hesitancy. Now, when you want lifestyles to change, that's big. Finally, I want to thank you, Roy, because you wrote the book called Beyond the Dispensary. Many have read it. I'm beginning to connect the dots in public health. I think Roy and the team you worked with is challenging us to do one thing that is so urgent now for this organization and for the university as a whole. What are we building? What are we planning to leave behind in terms of knowledge that can be form guidance for future generations? You gave us beyond the dispensary. What are we planning to give to Anjogu and the young clinical officer who has spoken here with a lot of passion? Simply, we need to translate this work we're doing to the books that will be read in the generations to come. We need to write these stories of contemporary community health that is beginning to connect these dots in the present time. So once again, Roy, thank you so much for giving us the gift of your time together with your family. It's an honor and a very memorable event and time to be here. We look forward to carrying forward this legacy, and more importantly, preparing the young people we are working with to take over. Thank you.
Thank you very much for that very insightful talk and the call to action. And I think where the young people come in is in the information technology usage. We might be a bit old school, and some of these things might be a bit hard for us, but it is your soft area. It is what you know and what you do best, and that can be an area that you can plug into. So thank you very much. I want to invite Dr. Lakati to come and bring in the AMREF alumni group so that they can give us a bit of their thoughts as we go forward. Thank you.
Thank you, Dr. Tambo. My work actually is very easy. I'm actually standing on behalf of Dr. Josephat Nyagero, who was supposed to do this, what I'm doing today. AMREF International University now is a university, has got 2 levels of alumni. We are privileged. I think we are the only university that has got an alumni of people who worked for this organization and they become alumni. We have people who have since retired, but they still want to contribute to this organization. And I want to challenge our students that you are very privileged. Take advantage of this, that there are people who have left these organizations, they've retired, but they are so excited to come and mentor us. We also have another level of alumni, that is the students. This year we graduated our first bachelor's group, and we are in the process of putting the structures in place to ensure that the alumni of the students who have gone through the training and the ones who started this organization work together. So I'm very honored to introduce, we have so many alumni here. I see people who taught us. I also see people who left to other organizations, but they still belong here. I see Koki there, she works elsewhere, but that tells you how important AMREF is, that even when you exit to work for another organization, you still feel you belong. So I'm very honored to welcome the Alumni Association. And I want to say that this association was made possible because of the energy and the commitment of Nikki. Nikki is a very special person. Nikki has so much energy that sometimes I wonder whether I have that amount of energy. When I became an AMREF staff in 2009, Nikki welcomed me when I was walking into this building, and I felt so much at home. And from that day moving forward, I felt I belong, and now this is my home. It is now more than 10 years since I've been working for this organization. Nikki, thank you so much for your energy. May you have health so that you continue running. I don't know how many of us can run as fast as Nikki. I want to welcome the Alumni Association, and I think this the first person who will take through so that the rest will be able to speak is Dr. Koki. Koki Kinagwi is also a medical doctor, a colleague. We have worked here together. We have changed spaces from colleagues, sometimes to student, and that is the interaction of life. Welcome, Koki. Today, Koki works with the UCSF, and we are so happy that you continue to even raise our flag where you are. Welcome.
Thank you so much, Dr. Lakati. I'm glad to be here. Dr. Roy, Shaffer and your family, to the AMREF International University Leadership Faculty, AMREF Health Africa in Kenya, Tandirangu, we have Professor Miriam Mwere, we have the AMREF staff present and ex-AMREF staff like myself and all other guests. I greet you all. As mentioned, Dr. Koki Kinagwi, I have had the privilege of working with AMREF actually for more than 10 years. I worked with Dr. Chris Wood at Afriapia between 2007 and 2010. And then I transitioned to AMREF Kenya, and I was there until 2017. And my years in AMREF, I can say, have really contributed to making me the public health specialist that I am today. I have learned so much, and even when I have gone, what I learned in AMREF and what I did at community level, the programs I was part of, everything have really helped me to be the person I am. And therefore, I am so grateful for the opportunity to work with AMREF, to meet with so many of you, and to be even here today. And that's why even when we are out, we are still, AMREF family. And yes, so this is really wonderful. And thank you, Dr. Roy, and everyone else who's really been part of making AMREF what it is from the beginning until today. We really celebrate your efforts. So we are here. What happened is, again, the strong connection and the need to just be together. There's a group that came together and felt that, we really need our alumni to be in collaboration, to network and continue contributing among ourselves. And so the Alumni Association was formed. We are still in the process of getting it registered, but we have made very big steps. And so we have a steering committee that was elected and is in place. I'm the secretary of that committee. I'm representing our chair, who's not in today, is Peter Mwarogo. And we have Pamela, who's our treasurer. Please, Pamela, you can stand so they can see you. And we have two other committee members. We have Dr. Violet and Anthony Kamau, also not able to be with us today. Now we also have the other alumni who are here today. We are not very many, and so I kindly request if they could stand. We have 3 colleagues who will speak. I think I will exclude them for now. Everyone else who is part of the AMREF alumni, please stand. You can see. Yes, so we are so happy to be here, and we look forward to just continuing this collaboration with the university, with AMREF Health Africa, and just being part of the great story that AMREF is in this country, in this continent. And so that I don't take too much time, I want to introduce our first speaker from the alumni. We have 3 people who worked closely with Dr. Roy. So I'd like to introduce and welcome Dr. Douglas Lucky. He started in AMREF in the late 70s as the first project director, and later went on to become assistant to Michael Wood, and later on also deputy director general. So Dr. Doug.
Good
morning, everyone. Thank you, Dr. Cookie. It's great to be here and quite an honor to be able to say a few words about my dear friend and old colleague, Roy Shaffer. We go back a few years, I think a few decades, back to the 70s, the 1980s. And as you know, that was the dawn of community health, community-based healthcare, and primary healthcare. Leading the way for AMREF during this historic period was Roy Shaffer, developing programs which totally embraced the concept of taking health services to the people and involving communities, members in that process. AMREF was very, very lucky and fortunate to have such an innovative pioneer on its team. I was on the management side of AMREF, and we always wished that we had the same level of consultation and involvement in Roy's work, which the communities were receiving. We were quite envious. But Roy had his priorities straight, being there in the communities where the action was, not at HQ, stuck in planning and management meetings. When Roy was not in the field, he was on the radio, publishing and beaming out his famous Dr. Amrith broadcast. And also on working and in publishing his very breakthrough and seminal publication, Beyond the Dispensary. Roy led by example with his drive, determination, insight, enthusiasm, sense of teamwork, which produced so many outstanding achievements in the field of community-based healthcare. Roy was deeply committed to getting communities to participate in defining their health problems and selecting options for interventions. The nature of Roy's AMREF work in community health was a forerunner for what was reflected in the 1978 WHO Alma Ata Conference on Primary Healthcare, particularly the component of community involvement. Roy's influence in that of AMREFs in the field of community-based healthcare was also recognized internationally. As students of primary healthcare, of the primary healthcare movement in this historic period of the 1970s and 80s, the name of Professor Ken Newell stands out as the author of the seminal publication, Health by the People. Professor Newell was the head of the Department of International Community Health at Liverpool School of Tropical Medicine and considered the force behind the concept of primary health care. In 1985, I had the opportunity to meet Professor Newell at the Liverpool School. And during that discussion, he cited the outstanding work in community medicine and community-based healthcare, which AMREF and particularly Roy Shaffer had developed prior to and following the WHO Alma Ata Primary Healthcare Conference. Professor Newell also spoke so highly of the outstanding work in community health by Professor Miriam Wary. As we all know, the Alma Ata Conference call for the health for all by the year 2000 still remains elusive. But some incredible strides have been made in community health and community-based healthcare based on the healthcare policies which have applied the principles set out many decades ago in Roy's Beyond the Dispensary and Professor Newell's Health by the People. Moreover, they are still as relevant and as current today as then. So I'm very, very happy for you as students of community health at the university, having this opportunity to meet and interact with one of the true pioneers and true legends of community-based healthcare and primary healthcare in Africa, Dr. Roy Shaffer. So, asante sana.
Thank you very much, Dr. Lucky, for that. Our next speaker is John Ramba. He was the director of the first communications and fundraising department at AMREF. And from there on, he became the deputy chair of the Flying Doctor Society of Kenya, and he's still there until today. Welcome, John.
Thank you. Yeah, still morning, actually. Good morning, everybody. I'm here, but I'm telling you just to be here because of Roy. It gives me so much pressure because I look at Roy in many ways. There are several ways that you can even probably identify us. Our hairstyles are pretty close. Can see mine is a little shaded like that, but they say in Africa, you don't lose hair, you gain face. So we are okay with that. But as I say, we go back with Roy long time, and especially when the founders of AMREF, Sir Michael Wood and his brother Chris, we work together. So to me, when I see Chris like this, when I see Roy like this, it just gives me that kind of look back on that. So I really say a big thank you to him that we are now still here. Thank God for that. So as I say, I really don't want to have too many things to say because quite a bit has been said about Roy. But I'd like to say he is actually 96, and I'm hoping to catch up with him one of these days. Thank you so very much indeed. Thank you. Yeah, thank you. I am here, of course, as I say, in my own capacity, but more importantly also, I do represent the Flying Doctor Society of East Africa, of Africa. And in that capacity, I'd like to make a small little presentation to Roy, because we do recognize his work with us for many, many years. So I'd like to give Roy, on behalf of my chair, Dr. Muringo, a lifetime membership card, so that this is it's an application card just in case you're anywhere in East Africa. Well, God forbid, but if you need to be evacuated to Nairobi or to any nearest specialist place, we do have the service in the Flying Doctor Society of Africa. And that's why I'm saying today, I'm so delighted to present this card, which is a lifetime card, to my good friend, Roy. And God bless you, Roy. Thank you.
Thank you, John. We have one more final speaker from the alumni. I'd like to welcome Joyce Naisho. She joined AMREF in 1978 to implement the government AMREF partnership program of primary healthcare in Southern Sudan, which was funded by USAID at that time. And so they used a lot of the materials that Roy had developed for their TOT and the training of facilitators. Welcome, Joe.
you can see me. I'm short because I'm Maasai. I'm expected to be tall, like Alice, but there are those who are short. And one of the doctors, Dr. Asante, who worked with us at from Southern Sudan project, used to say that the good things come in small packages. Thank you very much, Roy. I don't even know what to say. No, I shouldn't even be calling him by name because he's my uncle. Because our relationship goes far beyond joining AMREF. My grandfather was one of the first missionaries with John Staffica in Maasai land. And I think the Roys were the third or the fourth generation of missionaries who came to my village in Narok. And so Roy is the same age group with my parents, my mom. And so he's my uncle. If you saw me when I greeted him, I had to greet him with my head to give him the same honor that we give our parents in Maasai land. So that's how far Roy family and I and our family have come from. Now coming to work, you know, I had said the classic community-based training and practical on-hand material were the initiative of Roy Shaffer. And I just want to talk of three of them. One is breastfeeding, encouraging the mothers for breastfeeding. And my specialty was maternal and child health in AMREF and the community health department. And so breastfeeding was one of my activities. And so Roy used to say that we have to take back to the community how to breastfeed the kids. And why? Because every time you are using a bottle, it is like a gun. And he drew this little bottle with a gun inside that went in that tip. And then he says, if you are going to give a bottle to your babies, it's like you're pointing a gun at your baby. And it's a small illustration, but it said a lot. And that was on hand, practical. And I saw you guys have said primary healthcare practice, because that is what his vision was. The other one that I want to kind of emphasize, because it is material for training of trainers and training of facilitators. And I used that a lot when I was working in Sudan. You heard that I went to Sudan in 1978. Some of you were not born. But I'm not as old as him because he can't be my uncle. I'm only 78. And that leaky tin, and I kept on seeing it there, and I said, yeah, it is. It is a whole shower in a place where there is no water. And I've used it in a place called Aliria when we were having students there for training of facilitators. You use it because you save water, and where you're washing, you plant a tree. So it is also environmentally thinking. That was Roy's vision. That you don't have water, you have a little, you can use it for a lot of things. Washing hands, washing your face, washing the whole body, and watering your plant. It's indeed a good initiative. We appreciate it. The other one that I said that my specialty was maternal and child health. So I was training traditional birth attendants in the field, and it was the most good experience that I ever had. Because how many of those mothers are able to come to the health center, to the health facilities that young student was talking about? Very few of them. In Sudan, it was like 100%. So when I was working there, I used Roy's PBA Kibiriti kit. It is a Kibiriti box with the 3 or the 4 pieces of thread, and a razor blade, and a piece of soap. Isn't that a whole delivery kit for the TBS? It was very effective, and I hope you guys can even improve it a little bit more so that the mothers, the TBS, who are helping mothers in the villages can actually still have a clean and safe delivery kit, because we can't all have the UNICEF delivery kit, but you can make that one very easily. And whose idea was it? Roy Shaffer. There are so many others, I can't talk about them all, but we use his initiative in the field, in Southern Sudan, in Malawi, where I worked later on, and in East and Southern Africa. Thank you so much, Roy, for the many initiatives. And I think they are in those books which you had written. Thank you so much.
Yes, thank you very much, Joy. So that was from us as the alumni. We would have had many other people who wanted to say more and just share about their time working with Roy, but time is limited. So that really is just a token. And so we are grateful and we're so happy to see you. And kwaheri from the alumni. We are part of you still, and we look forward to more engagement. Thank you.
Thank you very much to the alumni team. And thank you for describing what is in this book. This is the book by Roy Shaffer, Dr. Amref, The Radio Talks. And here you can see a bottle that has some germs, and the poor child is running away from it, you know? And that's described, it's trying to express the idea that breastfeeding is more superior than bottle feeding. And so this is a book that simplified the delivery of healthcare and made it accessible and easily, and in a way that could be easily understood by the community. And thank you very much. This is another book that was written, but by Ruth's mom, but by your mother, Roy's mom. It was called, called The Road to Kilimanjaro by Ruth Shaffer. So my work now is to introduce Dr. Miriam Were, who worked very closely with Roy Shaffer. But before that, I'll give a brief history of his life. It's a very humbling task because it's a very, he's done a lot and he's been able to influence very many communities. And I was not yet even born, but through the research and through the people I have talked to, Nikki and so many others, I will try and summarize the story of Dr. Roy Shaffer. So Dr. Roy Shaffer is 96 years old today, and he's here with us. But the story of his life, where I was able to start it from, was in 1920. So in 1920, Roy and Ruth Shaffer, who were missionaries, they came to Africa. And they came to Africa in 1923 with their 2 children. And the children were called Ruth Marie and Harry Daniel. And Harry was 2 years and Ruth Marie was 6 months. And you can see that it takes a heart that is willing to serve, that you're willing to travel to go and serve, and you have very small and young children, and you're going into the unknown. And a few years later, our dear Roy was born. And Ruth and Roy came in as missionaries. They just graduated from the Bible school that was called the Moody Bible School in Chicago. And they had also received some basic nursing training. So armed with the Bible and the medical knowledge, they came to Africa to serve. And their inlet to the African continent was through the African Inland Mission. And so Ruth was a musician. She used to play the violin. And later on, as she kept interacting with the community, she also became an author. And you can see her book is here, The Road to Kilimanjaro. And it's a very interesting book that just explains the different people that they met and the different experiences that they had. And so they sailed from New York and came to Mombasa, Kenya, moved to Kijabe. And of course, there were no cars then. They had to walk 75 miles to Sia Bay, which is in Masai area. And as I've said, they had a 6-month-old, a 2-year-old, and I'm sure a few possessions. So it must have been quite something. Huh? So after a while, they later moved to the foot of Mount Kilimanjaro, where they were able to serve a community of about 200,000 Masais. And because Masais are nomadic, they don't have a household. They kept living in the camps. There's even a picture where they were in a tent. So they have small children and they're living in tents, following the Masais, teaching them how to read and write, teaching them how to read the Bible and what Christianity is. But beyond that, they were able to meet the medical needs of the community so that when they had a broken bone or diarrhea or whatever illness, then they were able to meet and serve the community. There's even a story where they tell of love brewed in their home. So one of their nannies and one of the gentlemen who was in their home, through the interaction that they had at Roy and Ruth's home, they later got married and even changed their names to become Eunice and Peter, and they got married. And so you can see that they were able to gel with the community very well. And they continued doing their mission work, doing Bible training, teaching reading and writing, medical service provision, and looking for innovative ways to improve the socioeconomic status of the communities that they served. Pastor Roy, he built many churches, and he spent many years trying to translate the Bible. And Ruth was also very instrumental in that. So they were able to translate the Bible from English to the native languages for the people they were serving. So after a while, after serving for about 35 years, they left Africa and moved away and relocated back to Europe. But of course, once a missionary, always a missionary. So at some point, they kept coming back in and out. But the initial service that they did took about 35 years. And there's a Maasai who gave a tribute in the book, and he says, Pastor Roy Shaffer was good. And like most Muzungus, your father was uncomplicated. His words had to do with God, with you and me, and nothing more. We knew what he wanted of us. So you can see that he was a simple man who was humble and was willing to serve the community in which he lived. Enter Dr. Roy Shaffer. Roy Shaffer Jr. So Dr. Roy Shaffer is now 96 years old, and we appreciate the many years of service that he has given to try and better the health of not only the global community, but of the Eastern community at large. So he was born in Kijabe, and his parents took him back to Narok, and they say he went back to Narok on the back of a motorbike. I wish I could have visualized that, but at least he was transported in a motorbike. And later on, Dr. Roy received his medical training from Albany Medical College. And later on, he got his MPH from Columbia University. Then came back to Kenya, lectured at the University of Nairobi, and later on became a district medical officer in Tanzania. Now, a friend of his referred him to AMREF and said, with the training and the experience you have, it might be nice if you would try AMREF. And he tried AMREF, and his interview was done by Dr. Michael Wood, which I thought was very interesting. And that was in 1962. And he came in, and after the interview, he began the excellent work that he has been doing in AMREF. He was sent to Tanzania to run the mobile clinic. As we are saying, at the community level, especially with the nomadic community, they keep moving in search of pastures, in search of water. So with the mobile clinic, then you're able to follow them, or you're able to find them wherever they are. So he did the mobile clinic service for about 3 years. And this is surely an inspiration and can be backed up by what Mao Zedong said. And he said, go to where the people are. You know, if you want to serve, go to where the people are. And this is what really primary healthcare is all about,
that you go to where the people are. This is what is at the heart of community health service and the provision of primary healthcare services, not only in Africa, but in the globe. So as you can tell that the concept of community health had not yet taken up. So the concept of community health as it is packaged now, had not yet begun. So he worked very closely with Professor Miriam Were, with all of you who are seated here, and you are able to develop the initial concept, and the work you started is what has been expanded to the globe and is now referred to as community health work. Through the reading, what I came to learn is that community health work actually started in AMREF. From the work that the people seated in this room did, these were the initial think tanks that put together the concept of going to the people, going to where the people are. And there's Dr. Margaret Kaseje, Mama P, Penina Ochola, there's Dr. Dan Kaseje, there's David Omambia. There's a whole team of people who worked very closely with Dr. Roy. So Dr. Roy Shaffer worked with the communities, he treated their ailments, and more importantly, he trained them on easy methods of preventing diseases. We have seen this one where he did radio talks. We also know he authored books. So he had tangible methods of passing on the information to the communities in order to positively transform their lives. In working with the communities, he didn't forget to work with the healthcare workers. After we finish our medical education, it is easy to keep serving without refreshing the information that we had. And so through the concept of training of trainers and training of facilitators, the TOT and the TOF movement, he was able to keep training and retraining the healthcare workers. And later on, he started the Dr. Amref radio talks, where now he was able to train the community on healthcare provision. So on 6th October 2021, I had the privilege of going to Saradidi. Saradidi is a small community in Siaya. And it was also a day where we were appreciating Dr. Roy, and we were appreciating him because that was the first place where the community health movement was started under the Chwa tree. And the Chwa tree is a tamarind tree, and it's now quite big. And so the concept was that they selected a few community health workers who are called Nyarweras, and they went through training under the tree. What do you think? That's quite inspirational. Huh? And they were taught about nutrition, income generation activities, agriculture, how to do research, health service provision. They were even taught how to make solar panels and how to utilize solar power, tailoring. And it was such an intense training because it was so hands-on and so practical. It was a training that went beyond the dispensary. And the Chwa tree has now grown. The Chwa tree is still there, but there's a whole dispensary that is run by the Ministry of Health that stands at that location. What do you say? Yeah, it's quite inspiring, yeah? And so how they worked is that these community health workers, they came and they were trained, and later on they went door to door and they would audit the community members. They labeled the households. Then the households were divided into numbers or areas, which were then followed up over time. So that if I was given a particular area, I'm able to know the pregnant women there, the children there, those people who've been vaccinated or not, so that I'm able to follow up and see what has happened to them. The Nyarweras also sought to understand the way of life of that community, and they continued doing the household visits. And in the household visits, they would not only encourage positive health, healthcare, promotion of healthcare, healthy healthcare services, they would also teach them how to make a living, how to keep chicken, how to rear, how to do tailoring, how to do better agriculture. And when the program started, the women in Saradidi, they did not have water. They had very high cases of cholera. They were dying from cholera and they were malnourished. The community health workers training was introduced. And by the end of that session, there was no more cholera in Siaya. They have clean water. Donors came in and built boreholes. Women groups were formed and they donated water tanks. Assemble Siaya is a place that has been transformed because of the work of the community health workers that we see before us. In fact, one of the ladies, Margaret Awor Onyango, she said, "You transformed our community. You brought us so much happiness. Thank you." Pauline, another lady, she said, "You taught us how to rear chicken. Poultry farming has transformed my life. I make a living through it. I have educated my children through the proceeds of poultry farming." Dr. Dan Kiseje, who worked very closely with Dr. Roy and is now the DVC of Gluck University, he's a trained community health worker. He said, "Let us not sleep. There's still work to be done." Siaya was suffering as they had many illnesses and diseases because of poverty. They suffered from poverty because of many illnesses. It was a vicious cycle of illness and poverty. Community health workers served to improve the socioeconomic status and the health of the community. There's still a lot more work we can do. The community has been transformed. Dr. Ken Orwenju, who is the MOH Director of Public Health in Siaya, he's also a community health worker. He was there at that event. And he said, Siaya is the first county in Kenya to be declared open defecation free. They have enough toilets, you know? In Kenya, where we have almost 40% of Kenyans who don't have toilets, it's key that Siaya have adequate toilets to serve their communities. On 4th October, there was a launch, you alluded to the launch of the Community Health Service Policy launch that was done by the MOH. And what's interesting is that the data they're using, the concepts they're using, the forms that they're using, and they will use to collect data were all piloted in Siaya. Siaya, Saradidi. Saradidi, Dr. Roy. Dr. Roy, community health work. Yeah? So Dr. Ken Okwenju is very sure that the work that AMREF did 40 years ago is what is pushing the concept of community health work, not only to Kenya, but to the globe. There's a lot we can learn, and the brains here are excellent. You know, they have done a lot of work for the community health work in Kenya. So what's interesting is that we had the older generation of community health workers giving their testimonies of how the work that has been done has transformed their lives. The other generation also stood up and they said they have been touched by the community health work that has been going on, and they are now also community health workers. So during the COVID season, the younger generation of community health workers in Siaya, they use the internet to reduce the spread of the virus at the community level. So they would tweet and, you know, send messages and WhatsApps about washing hands and physical distancing and all those things. And initially, Siaya had high COVID rates. The COVID rates came down. There was also a parallel pandemic of teenage pregnancy. You know, when during COVID, girls were not going to school, and so there was a lot of idleness, and we're getting a lot of girls becoming pregnant. And so these young community health workers noticed that there's a problem, and they used the internet again, and they got these girls together, and they brought in about 600 adolescent girls aged 10 to 19, spoke to them about the goodness of staying in school, ABCs, that they should not become pregnant. And when schools opened, 0% had become pregnant. What do you say? Yeah, so the intervention was very successful and the girls in Siaya remained in school. We also it was very interesting that the community health workers also know about research. So that was the case group. So they also had a control group of about 200 girls who were not spoken to or sensitized to about the dangers of pregnancy. And when schools opened, the 200 girls, out of the 200 girls, 9 of them got pregnant. So those are 4.5% of the girls who got pregnant. And so you're able to see that the community health workers at the community level, they have hands-on training. You know, it's very practical for them that they can do income generation activities, promote health, but also bring in scientific rationale in the decisions and the work that they do. As you can see, the need for community health workers is great. Community health workers are making a difference, a positive difference at the community level. There is work to be done. Mark Hyman, he says, we need community action and policies to support healthy communities. Dr. Dan Kiseje says, let us not sleep. There is still work to be done. And Mary Khan, one of the authors who is powerful, says, the power of community to create health is far greater than any physician, clinic, or hospital. The power of community to create health is far greater than any physician, clinic, or hospital. I'm humbled to call Dr. Professor Miriam Were, to come and share with us her experience. Okay, there's been a change. I'll call Jonathan to come and give a brief talk, and then we'll have Professor Were coming in to call on to Dr. Roy, who will then be able to speak to us before we go on. Thank you very much.
Thank you, Lydia. Dr. Roy. My name is Jonathan Dutton, and I am acting as the chair of the Council of Amref International University. And on behalf of the Council and behalf of the Board of Trustees, we want to appreciate you and everything that you have done to bring this university to where it is today. Now, I'm a new kid on the block. We've heard from many people who've been in Amref for a very, very long time, because we all know you never leave Amref. So people have been in Amref for many decades. Me, I only count for 7 years so far, but I know that this will be an organization that I am part of for the rest of my life as well. So we are very conscious as a council and as the governance structures of this university that we have an enormous legacy that we are responsible for developing and taking to the next stage. And I want to give you my commitment, Dr. Roy, that we will give of our best to develop this university, to honor you, to respect what you have done, and to build something that will warm your heart into the future. It's been a fantastic journey in just a short space of time. But we know that Amref has been built not only on founders, and we've seen their pictures going round and round, but also on certain individuals who are really pillars of what we have here in Amref today. And Dr. Roy, you are undoubtedly one of those pillars. So we want to appreciate you and honor you and publicly give our commitment to you that we will not let you down. And so it's my privilege and my honor to now hand over to another one of those pillars of Amref. And so, Professor Miriam, karibu sana.
Hamjambo, Mirembe, That is peace in my language. That's the greeting for Valuya people, in case you don't know. I almost said I can't speak now because the history of Roy is so wonderful. And I don't know what I could add. But let me add one or two things. First of all, when I started, I went into medicine and eventually into community health because I was a mother, a wife and a mother, teaching in high school in the 60s. And when our child got fever, we had nowhere to go in the night. But fortunately, we had a car. So we could drive to the doctors, to the hospitals. And then I began wondering, what about those who don't have cars in the night? When a child is sick, what do you do? That is what led eventually to me going into medical school and working, specializing in the community health. When I finished medical school and decided to specialize in community health, I was being asked, why are you making such a foolish decision? There isn't such a specialty in the world. Nobody will recognize you. You will be nowhere. You should be a cardiologist or an obs and gynae specialist, and a surgeon and whatnot. In fact, I was an intern in the surgical department, and the surgeon told me, you are a very good surgeon. I would recommend you. I said, no, I don't want that. I want to go to the community. And I must say, I want to say many years later that I have never regretted that decision. Because as it has been said, nothing is as important as empowering people to help look after themselves, to enhance their health, to prevent disease, and so on and so on. When I was thinking of community health and when I actually joined community health, it was a great inspiration to know that there was an American in Tanzania working on community health. And that American happened to be the young man sitting here. When I got to meet him, when he joined UNICEF, I actually worked with Roy after the Almata conference when I was in the University of Nairobi and he was in the UNICEF. And we became co-chairs for the National Primary Healthcare Strategy that followed the Almata conference. And then after that, as the saying goes, the rest is history. We collaborated in many ways. Then he joined me in the university and we taught together. And what was interesting about working with Roy is that we never thought, oh, we better, what? When we were going, because community health teaching includes going to the communities. And many times we used to worry about, if there is some Mzungu with us, we must make sure that things, we worry about it, how to make him comfortable or her comfortable. But not with Roy, he was just one of us. So we never had to do special things for a Mzungu. Roy was just my brother. So, and my professional colleague, I want to thank you. And the fact that he was a few years older than me made me very happy because in my culture, an older brother is very important. So I want to finish my remarks by singing you a Luya song for the older child. Because it was very wonderful to know that you are a professional and also my older brother by only a few years, because I'm almost there also. You start. Thank you very much. It was such a joy to know that you're going to be in Kenya and that we are going to see you and members of your family. Thank you very much for coming. We are delighted you are here. The floor is yours. Thank you.
God has given me special dispensation. My American accent is very difficult. So I am taking off the mask so you will understand what I am saying. Okay? Maybe my friend here with the tafasiri, badilisha my American to Kiswahili, but maybe not. Anyhow, I am so happy to be here, back in Africa. You know, in America, there's a book. I forget who is the author is, but the person is called Rip Van Winkle. Now, Rip Van Winkle was a man in New York, and he went to sleep by mistake. And he slept for 100 years. Then he woke up, Stajabu. What is all this? I feel like Rip Van Winkle. After 30 years in US, I came back here, and I'm not in Nairobi, I'm in New York. So many changes, it is almost shocking. But anyhow, time changes. As you have heard, my life began at Kijabi. I was born at Kijabi, and in 1925. So it makes me a little bit mzee. Jump ahead from 1925, jump ahead 36 years. I was in medical school, and Sir Michael Wood came to visit one of my professors in the medical school. And he said, oh, there's a young fellow here. He was born in Africa. And so I came to dinner with the professor and Mike Wood, and we talked about Africa. And he said, look, boy, you belong back in Africa. Why not come? Well, out of that dinner with Mike Wood, I got connected with AMREF. And AMREF, of course, then was a very small organization. I did not go directly to AMREF. I went to Monduli in Maasai land because I could speak the language. And I think Mike and the director of medical services was Mzungu at that time, friend of Nyerere. And because of that connection, I was posted to Monduli as district medical officer. We had a good time there. And also during that time, we had our first connection with Professor Mann of Vanderbilt University. And we facilitated his doing some research on cardiovascular disease. Why do the Maasai, they eat a lot of high cholesterol food, but they have no cardiac disease? So we were doing that research. Here was Vanderbilt University, Roy Shaffer, the DMO, and sort of Kichini was AMREF, not officially, but the mobile unit came down and we put them together. I didn't tell Dar es Salaam very much, but I think they very kindly let us do the work together. So it was Vanderbilt University, Ministry of Health, Tanzania, and AMREF doing this research in cardiovascular disease. So that was my beginning with AMREF. Finally, in 1963, we moved back to Nairobi to be full-time with AMREF, working with the mobile unit. We went to various places. We were experimenting. What is the point of mobile unit? And one thing we discovered is you cannot mix curative medicine and clinical medicine. The two are not an easy mix. But anyhow, we explored around. We went to the Bahima out in Western Uganda. We went to some Turkana visits in Maasai land with the mobile unit. You might see some old pictures of the mobile unit. Some rich Americans, the button weavers, donated those mobile units. But anyhow, we also cooperated with the Mvumi Hospital in Tanzania, doing community health among the Gogo people. In America, there's an American band, a very American And what is their name? Google. And so we enjoy that connection. Anyhow, by 1967 or around there, my kids were getting ready for university, and we wanted to help them to get started. So we left Africa and went back to the US to do public health in New York while our kids got started in university. But I'm an African. My genetic Hamu came back. Africa was calling. So we came back to Nairobi University Medical School. And there I joined Miriam in the Department of Community Health from 74 to 78, doing community health, training trying to help young, bright doctors to look over the walls of the medical school out to the community, get away from the surgical suites and the $1 million surgical practices of money, Wabenzi, help them to look over the walls of the community. And we'd go out to do leprosy in West Kenya with these medical students. And those were nice years. And during that time, I got to know Dr. Dan Kaseji, who was a medical student at the time. Finally, in 1978, Chris Wood, he pigged Hodi on my door. He said, Roy, what about us? What about AMREF? So I finished with the University Medical School, came back home to AMREF, you might say. Now, that was about 1978. And at that time, everybody was talking about Alma Ata, a big conference in Russia, Alma Ata, and the motto, health for all by the year 2000. It was like saying Jesus Christ is coming in 2000. It was crazy, but everybody was talking health for all by the year 2000 through primary care. Well, what is primary care? It's a very strange word, primary. And I heard some surgeons talking about my part in primary care. Well, many of us were concerned, what do you mean by primary health care? And my thinking at that time was influenced by two important historical people. One was Mao Zedong and one was Paulo Freire. You say Mao Zedong, isn't he a communist? Well, sure, he's a communist, but he had some very good ideas. And Mao Zedong, one of his ideas was start where the people are at. I don't know how you see that in Swahili or Chinese, but it's not good English grammar, but it's good philosophy. Start where the people are at. Pale. Anyhow, that was his philosophy. That was one important point. The other was Paulo Freire, who was a Brazilian writer. And his emphasis was on health education, problem posing, not solution giving, but problem posing. Throw a people a problem to solve, and they learn by solving problems. So those are two important foundation stones of what we saw as training people in primary health care. Primary, what do we mean by primary? Well, start where they are. Where are they at? They're not in the Kenyatta Hospital. They're not in the district health center. They're not even in the division clinic or the mission dispensary. They are beyond the dispensary. They are beyond the dispensary. And that's why we wrote the book, Beyond the Dispensary. That's where prevention really begins. And I didn't see a picture of it there, but I hope you will read the book, Beyond the Dispensary. About this time, the time of Alma Ata, along came a young English man by the name of David Cowling. He represented an American organization, World Neighbors. I think World Neighbors must have had a lot of oil money, or somehow they had a lot of money. And David Cowling got interested in AMREF and our ideas about beyond the dispensary. So he provided money, but more important than money, he provided contacts. Somehow he was like Johnny Appleseed. He traveled around East Africa and made contacts with important people in the community health side, with all organizations, Catholic, Protestant, government, you name it. He had many contacts. I sometimes wondered if he was CIA. He was so communicative in East Africa. Anyhow, he went back to Arizona or wherever World Neighbors is and persuaded them, so look, Amref is a good outfit, give them some money. And Doug could probably tell you how the money came, but anyhow, it funded what was the beginning of community-based health care, CBHC. People get tired of me saying CBHC, but community-based healthcare, not dispensary-based healthcare, community-based healthcare. Vijijini, pale, where the people are, as Mao Zedong said, start where the people are at. And so we began to pull a team together, and through the influence of David Cowling, it was not just Amref, although I and Penina Ocholo were the Amref people, but several other people formed the team. And a third most important member of the team was Geraldine Heising. Geraldine Heising was a Dutch nurse. She was head matron at Rubaga Hospital. And you know, an English system matron, she is like God, dictator, Mama Mkubwa. But you know, she sat there at Rubaga Hospital and she said, I got tired of seeing the same children with the same disease, get the same treatment, go back to the same village, the same life, come back to the hospital with the same disease, same treatment, recycling babies, recycling the same diseases. She says, I got tired of that. So she left the hospital, came down to Kenya, joined the Catholic Secretariat, and she joined our team to break the cycle, at the village level through preventive care. Others in the team, I mentioned Penina Ochola. I think Chris Wood stole her from the Ministry of Health, and then myself and Dan Kaseje. Well, I'm not sure if he was with Amref, but he was in the medical school at the time. And there was a nurse from Maua Hospital and somebody else, a German primary health, PHC, Peace Corps. What's the German Peace Corps? Anyhow, her name was Beatrice or something like that. We were very multi-organization, multiracial, but we were really a team. And we would go out trying to do community, planting the seeds of community-based health care. For Elkanah Odembo, he followed Penina. Penina Ochola was the one we stole from the ministry. Elkanah, I was in the States. One of my children was getting married. And I heard about this guy, Elkanah, from West Kenya. He was in grad school. And I tempted him to come to my daughter's wedding. And while he was at my son's, too. A son and a daughter were getting married at the same time, the same place. And I sent him a ticket, an air ticket. He flew to Albuquerque. And I twisted his arm and he came to Amref. Maybe Doug signed the contract for Elkanah. And he came to Amref here, wherever the building is. He was a very tall guy. We gave him a desk, but the desk was too small. He could not fit under it. So we had to put higher legs on the desk so Elkanah could sit there. Elkanah later, I visited him in Washington, D.C. when he was ambassador. That's the kind of people Amref trains, you see, when you go from Amref to be ambassador. He was the ambassador to the US, Elkanah Absalom. Anyhow, I'm emphasizing that we were a team, multi-organizational. We were not fighting each other for turf or for power. we were intercultural harmony. Well, we were trying to train community health workers. What are the community health workers? Well, people mistook us for the Chinese barefoot doctors. They were not barefoot doctors. And in fact, the whole barefoot doctor idea died. It didn't work. They were CHW, community health workers. Now, some people came along and tried to take this idea. They got the letters mixed up. HCW, health center workers. Baloney. They were not health center workers. They were the people's choice. Kijiji, they were community health workers, not dispensary workers, community health workers. And mostly they were women who were successful in their own lives, so successful that they could give a few hours time to the community, and also people for helpful, generous with their time. Those were the kind of people who were made into, we were trying to train as community health workers. What was our mode of teaching? Well, it was certainly not lecture. We didn't have any loudspeakers or didn't have any textbooks, but we just started where they were at. We were not Elimula Akalamu. The Maasai, they used to look at the nurses and they said to me, she's a real nurse. But that other one, she's Sister Yakalamu. All she ever did was writing, notes, never sitting down kononi with the people. Okay, we were not Elimu Yakalamu. We used pencils, but more person to person. And so our mode, there were five fingers, you might say. We were learner-centered. The student was the center of importance, not the professor. The student was the center. The learner was the center of attention. What was our method? Our method was Paulo Freire, problem posing. Many teachers just put a funnel on the top of the head and they pour in knowledge, facts. We were problem posing. We put a Namnagani. How do you do this? Why? Problem posing. The third was self-centeredness. They themselves discovered the answers to the problems. They discovered, we helped them to discover, but the penny had to drop. The light had to turn on. I remember one woman in Sardini, we were talking about water contamination, and suddenly she stood up and she said, you mean I've been drinking that man's piss? The water coming down. Suddenly the idea of the connection of polluted water got through to her. Magani. Self-discovery. And then finally, we emphasized action taking, not just kalamu books, but we made little arm circumference strips to teach for malnutrition, a child's arm. We made these little papers. Some of those community health workers even thought we were a cardiac surgeon putting a scalpel into their hands. Wow, I am doing something. I am measuring. I'm getting some facts. Me, an uneducated, illiterate Jalua woman, I am a technologist. Self-action, we could do something. I can measure this child. He's green or yellow or red on the matter of malnutrition. So I've given you 5 things. Learner-centered, problem posing, self-discovering, and action taking. Those are, you might call it LEPSA. There's my one personal thing. Learner-centered, problem posing. It's 4. action taking, LEPSA. It's not a new method of education. It's simply an acronym to remember 4 important points. 2 of those points, remember, came from one from Mao Zedong and one from Paulo Freire. So LEPSA learning, you might say, was our method of training. And who were we? Well, people remember the taught courses, because we said we were training of trainers of community health workers. Really, we were training community health workers directly. Some of them who would become trainers. We were bringing them outsider nurses, Mzungu nurses with an RN degree. We were training them in our method. So the word taught, training of trainer, it's a little bit like rubbery. It had many meanings and had nothing official, of course. The Ministry of Health did not recognize taught, but we did give certificates to show that they were participants in this kind of training and learning. So you will hear a lot about taught courses or TOF. Geraldine, she says, I don't like trainers, I like facilitators to make the learning easier. So sometimes we call them TOF courses. But the whole idea is really facilitators. Those of you who speak French know the word facile means easy, easyfying, making learning easier. That's what we mean by TOF, training of facilitators. Okay, I'm talking too much. How much time, that was when I left in 1990, how much, when you plant a tomato plant, a seed, what's the germination time? How long does it take? Anybody a farmer? Any farmers here? How long does it take a plant to grow and produce seed? Well, how long for CBHC to produce seed? I don't know, but we are waiting to see how long it takes to grow and reproduce and continue. Does CBHC exist? In Saladini, it still exists. I hope it exists in the other places we visited, like Ukambani and Kajiado and Kagando on the Congo border, and Turkana, Elie Springs in Turkana. We planted the seeds. I hope something survives still from the whole idea of community-based healthcare. I hope I talked about Rip Van Winkle, the man who fell asleep for 100 years, woke up, Tajabu. I hope in the year 2121, they will find some evidences of our CVHC work, that in the hearts and the minds of some people beyond the dispensary, these ideas continue. My years at AMREF were very happy. I felt my years were beneficial to the community, and I felt gratified by them. But I have a friend, his name is Onesmo Ole Moyoy. Onesmo Ole Moyoy he's from the bush. He's a bush kid from the border Kenya and Tanzania, but he was very bright. And he went to Old Moshi Secondary School. He was a good runner. He qualified for the Olympics. He qualified to be a distance runner for the Olympics. But at the same time, he qualified to go to Harvard University. What a choice. Will you run in the Olympics or will you go to Harvard? Well, he chose to go to Harvard. And he went to Harvard Medical School and came back with Kabete. He's a preventionist. He's a preventionist. He's not a surgeon. He's not a cardiologist. He's a preventionist through immunology. He's a specialist in immunology of zoonotic diseases. So he's now head of ICIPE, ICIPE, on Moyoi. But just to bring me, I call him because I want to use his language. In the Maasai language, they say, Medanyan kimujin oboilashi. Medanyan kimujin oboilashi. Of course, my friend, she could agree. One finger alone does not crush a louse. You know, when you have rice, one finger alone will not. It takes two fingers to crush a louse. And my point here is that it takes preventive and curative before we're going to get rid of diseases. Lazima, the two fingers. It takes two fingers to crush a louse. Can anybody give that to me in Kiswahili? Okay. Kidole kimoja haivunji vunja. Okay. I'm talking about balance here. We have an election coming next year. You're going to have a very difficult choice. It's going to be Kali Sana. Gideon or so-and-so or so-and-so. Either or. You must choose one. Yeah, you can't have both. Your choice is either or. But in health, we must not have an either or. We must have both. Have curative medicine and preventive. We must have the beyond the dispensary health care to match with clinical care. I have a dear friend, David Silverstein. He's a cardiologist. He's a curative man. I have another friend who's a surgeon, Penino Chola. Her husband is a surgeon. He's a man of the Kisu. We are going to have both in Kenya to have a balanced approach. And yeah, so and I hope we can keep the balance between the two. There's a danger of technology, and digital technology will take the place of the community health worker. Nothing will ever take the place of the true community health worker or the way thing. Even the best digital technology, these little machines that you young people use all of the time, I think when evolution takes 5,000 years from now, we human beings we have evolved, if evolution is true, and we'll have no fingers because we don't need fingers. Nowadays we talk with our thumbs, don't we? Well, I worry about digital technology taking the place of the community health worker. We still need to have that balance. You may have seen me walking around, and I have a stick somewhere. Oh, thank you. For some reason, my gyroscope, my vestibular apparatus in my ears, gone. That's why I look like I'm drunk sometimes, and I have no sense of balance. And so my stick is like a third leg. So loss of balance. I hope AMREF never needs a stick to restore the, because of the loss of balance between prevention and cure. We need our surgeons. We need Dave Silverstein, the cardiologist. We need these curative people, but we also need the mamas in the community level to keep the balance. So we do not need a stick. That will be a natural balance. There's much work to be done. We used to have a song in Saradidi. Penina usilale, penina usilado, padoma pambano. The luta continues, the fight continues. Things are not finished yet. And so I say thank you for having me. I hope, you know, this is Saturday morning. This is the time to be playing golf or to go shopping or have your hair fixed or go Shambani to visit your wazazi. This is not a time for lectures. I'm sorry that I have taken your Saturday morning, but I hope I have given you a little bit something to remember instead of golf. Thank you. One is U.S. State Department. My granddaughter is in the State Department. I finally have a chance to say howdy to the U.S. Secretary of State. Don't forget third world in your money. So she is my howdy lady.
What do you say to such inspirational words? Yeah. While at Saradidi, we set out on a task to count how many SDGs were met through the work of the community health workers. And you know, SDGs did not come 40 years ago. It's something recent. So the community health workers were ahead of their time. So we'll try and go through them, and then we'll be able to present a gift to Dr. Roy. So the first one is no poverty, yeah, no hunger, good health, gender equity, clean water, decent work and economic growth, innovation and infrastructure, reduced inequalities, sustainable communities, climate action, and partnerships. 11 out of 17. The community health workers were ahead of their time, and they made us proud, and they did a good job. And so I want to call Jonathan, Meshach, and Professor Were to give Dr. Roy our gift before we invite Dr. Lakati to give the last comment. Karibuni.
We put him.
Yeah. Can he come? Yeah.
Yes.
We are coming to the end of our very, very exciting day. And I just want to translate what Dr. Roy said. He said, Ashe Oleng. Ashe Oleng is thank you very much in Ma language. I actually didn't believe that he speaks Ma until when he told me his age group. So actually he's a Ma elder, as Joy said. I want to give a vote of thanks. And before I do, I just want to make one announcement. After this, we are going to walk outside here and have a group photo. Betty will lead us through the process of the group photo so that we get to capture these moments because it's a very important day. After the group photo, we shall go back to where we had our refreshment and have our lunch. From there, we interact, we know each other, and then we are free to leave. So I'll go straight to look at, to take us through the vote of thanks. This day we would not have been here if it is not for Dr. Roy Shaffer. Dr. Roy, you have brought so much joy. You have made an impact in community health. You have made an impact to AMREF, to so many communities. And you have actually, today we have learned so many things. And I was listening to as you talk, and I was teaching my first year students about primary health care, Alma Ata, and I think for the first time they felt that it was real, because I think they felt that we are just talking history. Thank you so, so much for the great work you've done, and just even bringing us together this day. We have no other words to really appreciate you, but to say, Asante sana, Ashe Oleng. Thank you very much, Dr. Roy. I also want to thank the leadership of AMREF that has continued to do the good work. We have the global leadership of AMREF, and Jonathan is representing that leadership. Thank you so much, Jonathan, for even spending time with us and just assuring Roy and his family that the work that they started is going on, and we are not going to let the work down. Thank you so much. I want to thank Dr. Meshach Ndurango. AMREF Kenya is actually the pillar firm of AMREF. And as a university, we really look at the work AMREF is doing. It is our laboratory where we train our students. Thank you, Meshach. Thank you for continuing to support us as a university. And thank you for even spending time with us today. I also want to extend our appreciation to the Martin Mushangi. In absentia, we have Jojo Ele. Martin Mushangi is a project director for WASH, and through his project, we were able to support this function. And that is the work Meshach is leading in AMREF Kenya. So tell Martin, we are really, really grateful. And our students normally get a chance to meet with Martin. So thank you very much, Martin, in absentia. I want to appreciate the alumni. I don't know any other organization that has got people who worked there and they come back. We feel so encouraged, those of us who are still working in this organization, that we have people we can call. We have people who we can call to talk to our students. We have people who we can actually see the work they did. Our alumni, all of you, we want to say thank you very much, Asante Sana. Keep guiding us, keep directing us, correct us, and support us with the mentorship. And the next generation that is sitting there is looking forward to your experience. Because even when you listen to Roy, you note that that work has not ended. We still have people giving the bottle. We still have, why did we spend so much time teaching people hand washing? That was started many years ago in this COVID era. It means that there is a lot of work to be done. So I want to thank you, the alumni, for your time and even the fact that you came to spend time with us today. Asanteni sana. I want to thank the team that is sitting behind there. You see the group that has been able to get us this technology running, the group from Dagoretti. There is also there is a young man who works here for us with Amref called Bethuel. Bethuel is very passionate about heritage and preparing all the slides. And Bethuel actually doesn't have that training, but he has that passion. So Bethuel, we really appreciate the work you're doing. I want to appreciate Nikki again. We all know that Nikki embodies the spirit of Amref. The spirit of Amref that cares, the one that says that if the community is not coming to me, then I'll go out to them. I think if you have ever interacted with Nikki, you know what I'm talking about. Nikki, thank you very much. You have so much energy. Keep running. I think I pray that you continue to have good health. Don't feel shy because you do a fantastic job. You really do a fantastic job. I want to also remember, I did not forget her, Professor Miriam Were. Okay. Okay, thank you, Prof. We shall again reintroduce them because we are going to take a good photograph. Thank you, Prof. Before I end, we shall introduce the family of Roy Shaffer. I want to thank our students. I know today is Saturday, and they came. I hope that you've been inspired, that there's a lot of work to be done. Am I right? Can we see our students? Actually, the students we see here is a very small portion because many of our students are studying online. They chose to take the online model. COVID came and taught us different things. So we also realized that we can study online. So this work, whatever we are doing today, is being streamed live, and the ones who are not here, they are following online. Thank you so much for choosing Amref International University. I hope today has also made you see that you made the right decision. I hope that you feel inspired that when we sent you to the field and you say there are no roads, I don't know what roads Roy was using. Because we send sometimes students to the field and they tell me, oh, Samburu is not safe. It is not safe. There are no roads. I don't know 1960, which roads you are using. 1980s, which roads you're using. It challenges us, this generation, that sometimes is a bit selfish. So I want to believe that listening to Roy, the alumni, you're able to see that it is the people who want to make a difference that can actually impact on the community. Thank you so much for coming. We appreciate you. We appreciate you because you are the next generation. With that, I hope I have not forgotten anyone. I want to say all of us, we have done a great job. Roy is here to show us what he's been doing we have seen what he's done for the last so many years, and there's a lot of work to be done in Africa. I think at the time, AMREF was not in West Africa. Roy, now AMREF is in West Africa. AMREF is in Malawi. It is in Zambia. It is in so many other places. So the work has grown. With that, I want to honor the request from Professor Miriam Were, just to request the family of Roy to stand so that we know them again for those of us who came late. Maybe if it's okay with you, you can just introduce yourselves.
Good afternoon. Thank you. My name is Emily Shaffer. I am Dr. Roy's granddaughter. And no, I just thank you all for coming out today and for doing all of this. I was just a little girl in the 80s and just loved going over to Granny and Grandpa's house for fun and swimming. And I just knew that Grandpa used to go on Flying Doctors, but I didn't really know. I've learned a lot today. And I'm just so impressed. And I just thank you all for even teaching me the extent of Grandpa's pioneering work in community health, along with so many of you. So yes, I am in the US Foreign Service. I'm a diplomat. So I'm currently posted in South Africa. So I just came up for the week to be part of this and to see Grandpa and my aunt and uncle.
I want to greet you on behalf of Dad's other 5 children and his grandchildren and the great-grandchildren. They all have been following Dad's, what I call sentimental safari, step by step, day by day, photo and video by photo and video, thanks to technology. They would all wish to be here and meet you. And thank you for honoring Dad today. And I'm his 4th born out of 6. And it's a privilege to relive memories here. I would just like to say a thank you to my late mother, who enabled Dad to be out in the bush while she took care of 6 children. And she did it gracefully and with great joy and great honor. And because of her support, was one reason Dad was able to do what he did and continues to do what he does. And I want to remember her. And thank you again. It's a pleasure to be here. This is my husband. I know he wants me to speak for him. He's retired from tourism in Tanzania. Karibuni sana, anyone who wants to come visit Tanzania. We have space for you in our home. And I've met a neighbor of mine today, a Tanzanian Kenyan student here. There you are. Nicole, yes? Yes, so I've met a neighbor here in Nairobi. Thank you very much.
Thank you very much, everyone. Now we all know Roy's family, so we are going to go to our last session. The seats have been prepared, so Betty is going to guide us, then we'll take the photographs. Roy will be in all the photographs. So this day, the official part has ended. Enjoy the social part. Before we close, we are going to, because this is an important occasion, we are going just to play the national anthem, then we shall exit. So we can stand for the Kenya national anthem. Our students, please don't go because we are taking a photo with you. A photograph session with Roy and the alumni, followed by the management of Amref, and then the students. So we are going to have the first photo with Roy and the alumni, the second one with the leadership of Amref, then with the students.
Ee Mungu twaomba uilinde Jumuiya Afrika Mashariki, tuwezeshe kuishi kwa amani, tutimize na malengo yetu. Jumuiya yetu sote tuilinde.